Hi everyone, welcome to today's Facebook Live. My name is Dr. Sally Foote. I am a veterinarian and animal behaviorist, and I provide expertise in less stressful animal handling, fear-free techniques to be used in veterinary practice, animal shelters, as well as at home. You can find me at my website, drsallyjfoote.com, and I also provide behavior consults for clients as well as shelters and veterinary staff. So today we're going to talk about low-stress ear care for cats, how we can get ear medications into cats in a less stressful way, and also some alternatives or different choices in ear medications that we can use in our cats. The last week or so, actually last week, one day, and then yesterday, and then I'm going to fill in another 2 days, I was helping out a friend of mine by working at her veterinary practice, and which is wonderful. You know, I like at times getting back into practice because it helps to keep me up to date on not just clinical skills, but what are clients what are clients having issues with their pets? What's kind of right now we're seeing, in general practice. And I actually had 2 or 3 cases of cats that had ear mites in the past. They had some of that brown, crusty black debris in their ears, which you do see when they have ear mites, and they didn't have ear mites. So they were having then a secondary yeast infection in the ear, inflammation in the ear. And this can happen because of how the ear mite lives down in that ear canal and creates irritation and inflammation, and that can then cause a secondary bacterial infection or yeast infection. Now typically we always had products, or still have, Trazodone. Trazodone is a good medication for killing the ear mite. It also has an antifungal in there for treating yeast infection, and it also has some I believe dexamethasone in there. Now the tricky thing is we've got a cat and those ears are painful. I mean, they really are. They're doing okay sitting there, but as soon as you touch the ear, they start pulling their head away. They flatten the ear down, they hunker down. And now you're trying to handle the ear and get those drops in, and they're pulling away. And if you don't get the drops completely in the ear, then they can't, bathe the canal to not only kill the ear mites or to, treat and get the infection down. If you have a lot of debris in the ear, a lot of wax, a lot of exudate in the ear, the medication cannot penetrate and get to the skin level, basically what it is, that epidermal layer in the ear canal, which is where that medication really needs to be able to be more effective at getting rid of the yeast, the bacteria. So it's just a struggle. And it's a struggle, touching and handling the cats. Now, if we have to use or need to use a topical medication or do the cleaning, here's a couple of things that we can do. I apologize I don't have Binks with me. My little live model, he moved to Champaign, and I'm going to get him down periodically, but he isn't living here in Tuscola. But we have my stuffed cat. So the first thing is the lidocaine ointments. Lidocaine ointments and lidocaine creams. You can take a little dollop of it. You can even have it on just your finger to start with. And without touching the head much, you're going to just take your middle finger and swipe, just your middle finger to kind of hold the skull, your middle finger and then your thumb on the jaw, and wipe real quick on the inside of the ear canal and flap, and leave that cat alone. Leave that cat alone for 5 minutes. Go do something else. Go do something else in the office. If it's for home care, dispense the tube or tell your clients they can purchase lidocaine cream at 4% lidocaine over the counter. It is icy hot. That brand that they can buy over the counter. They can do the same thing. Quick wipe, leave the cat alone for 5 minutes. Maybe do this in the bathroom where the cat is confined so they're not running all over the house. Okay, now then 5 minutes later, mineral oil. Do not use a lot of the acetic acid-based ear cleaners. While the high pH of the acetic acid is inhibitory, it helps to eliminate the yeast infection. Frankly, they're irritating. They tend to kind of burn in the ear. So mineral oil is a good ear cleaner that's more soothing and a little easier on the cat's ears. It's still tough doing that ear cleaning. So if we need to get the debris out or we need to check for ear mites, it's important to actually look to see, do we have mites or not? Let's just not go on that assumption. Using mineral oil is best. Okay, so that's cleaning the ear, handling the ear. Lidocaine is one tip. Now for restraining the cat, We're going to use the cowl technique. Remember, this is our scruff substitute. Please do not scruff the cats. Why? Not only do they now associate this pain and discomfort with your hand, look at where we're grabbing. We're grabbing right behind the head and the ears. This head is hypersensitive to touch because of the inflamed ear. So now if we're scruffing back here, they're going to really dislike the scruffing. And even if they don't become aggressive, the next time anybody needs to touch around the head, they're going to be running away. They're going to flip their head to bite. It's just going to be worse. So please do not scruff and instead use the cowl technique. So the cowl technique is taking something like a pillowcase because of the size and length of it. And before you do anything, any touching or handling on the head, you've rolled it up, hands by the side of the head, quickly wrap around the head. Sorry, it's easier on a live cat. And come around. And then you twist the end so it's snug. And now you have the same anchor point as a scruff, but no one's pinching the head. You do not have that stimulus on the body that creates the pain. And then always hold your hand down against the body. Now with another assistant, or even if it's just yourself, you can take, it's over here, a chip clip on the towel, not on the cat, to hold this together. Let me do this over here where it's a little bit better to hold it. There you go. So that can do the holding for you while now you can do the drops, etc. in the ear. And this cowl around the neck helps to prevent them from being able to flip their head or to bite you. Okay. Now, frankly, we did the quick swab. We know it's ear mites. We should not use ear drops for mites at all anymore. It is so painful for the cats. The client cannot successfully get the drops in the ear. So therefore, it's oftentimes becomes a chronic problem. Thirdly, ear mites live on the hair outside of the ear canal in addition to in the ear canal. If we're only using ear drops, we're missing part of the infestation that can then get back in the ear canal or spread to another animal in the home. And many of our clients have more than one cat in the home. So if we have one cat coming in showing ear mites or a new kitten that's been adopted, this kitten could give it to other cats or dogs. Dogs do get ear mites. And we could really have a problem that keeps swapping around the house if all we're using are ointments. Revolution, the Selmectin, is a monthly treatment, and 2 monthly treatments will kill all the mites in the ear canal and on the skin. So you give the cat who has ear mites the treatment for 2 months, and it will eliminate the ear mite problem without ever having to touch their ears. It is a game changer, honestly, with cats. I had one client years ago bring in this cat that was about a year old, and she had called to say, like, his ears are really bothering him. I can't even touch his head. He gets really aggressive. He tries to bite me, even if we go to pet him. He has had ear mites. I could never get treatment in. And I said, bring him in. And so I examined him real quickly, got a quick swab, confirmed it was ear mites. And I said, you're putting him on Revolution for 2 months minimum, maybe 3 months. And we're treating the other cat in the home, even though you're not seeing symptoms. And I said, bring him back, this kitty back, in a week. And at that time, we'll try to clean the ears. Because this cat's ears were very inflamed. And I believe I may have also put him on some prednisolone also to give him some pain relief. So she brought him back a week later, and his ears were actually very clear. There wasn't much debris in there. And she said, he is a different cat. He's allowing us to pet him, allowing us to touch him. He's not digging at his ears. And she said, actually, some of that debris started to work out. So I took some mineral oil and wiped out some of the chunks of garbage that was coming out. So we cleaned his ears, and he was fine. And that poor cat had gone for a year with ear mites because she could not get the drops in. And she was not given any other suggestion or any other way of trying to treat her cat. So that's the point of this Facebook Live, is to let's think of all the different ways, medication-wise, and really think of what's best for the cat for getting rid of this infestation and making it less stressful for the animal and also doable by our client. So Revolution is the one brand. I believe it is coming under some other generic trade names now, the Selmectin. It is applied once a month to the back of the neck, on the skin of the cat that's affected, but also housemates. We need to treat those housemate cats. Now, sometimes it's not ear mites, okay? It is that yeast infection, secondary bacterial infection. And so again, now the ear it's like, red, it's inflamed. You've been digging at it. You checked, it's not ear mites. You see, okay, we have yeast in the ear. While it is off-label, Claro can be used in cats. Typically 1/2 of a tube in each cat's canal, and you leave that alone for the 2-week period. No cleaning of the ear again, no touching, no swabbing. Put that in the cat's ears, and it's definitely a less stressful way of treating the ear. Some of the apothecary compounding pharmacies have made up the lanolin-based or other kind of long-standing, ointment-based ear packs. I have also used those in cats, where we're getting that combination of the antifungal, the antibiotic, and a long-standing steroid in an ear pack. I've put those in the cat's ears, said nobody touch the ears, do not clean the ears, do not manipulate around the head, just let that sit in there for a week, 10 days. We'll do a recheck then, and those ears have cleared up. The cat allows us to clean the ears because the pain is reduced and it's eliminated. Now we also need to think about, in these cats who've had some chronic ear infections, ear inflammation, why is it coming back again? Why is it returning? And just like in the dog, the majority of these repeated ear infections, with the yeast and bacteria are really an underlying allergy problem. And food allergy is one of the more common allergens. So we need to make it also very clear to our clients when we put them on something like feline ZD that the only food to cross their lips, that includes treats, canned food, and all the other house cats, everybody needs to be fed separately in different rooms or bedrooms, and close the door so we don't have this cat who's been getting on the ZD to go over there and eat the Friskies from the other one. So you're going to give them 20 minutes, 30 minutes to eat, then you're going to remove the food bowls, and then you'll do another feeding later in the day. We're going to switch them to a twice a day or 3 times a day feeding, and we're going to control that this cat who is going on the ZD only gets the ZD, and we know it. So often the failure in the hypoallergenic diet trials, it's not that the diets don't work, and it's not really so much that the clients aren't trying, it's that this was not made really clear to the client that the only food to cross this cat's lips is to be the ZD, and how to do it. How to say, well, 1 cat goes in this bathroom, or 2 cats go in the main bathroom with a bowl of Friskies and a little bit of canned food, and this cat's going to go in your bedroom and eat, and you're going to close the door so the cats don't swap around. You're going to sit down for a half an hour because that's how long they're going to have to be able to eat. They'll learn how to eat that quickly in a half an hour. And then you're going to remove the other food so this cat doesn't go into the other food, and you're going to do it again at noon, and you're going to do it again late at night. And the cats will get on this, scheduled feeding. They will. It might take a day or 2, but they'll get there. And then you will know, because it may take up to 8 weeks for this cat to be on ZD only to clear out all those antigens from the food allergy out of their system, knowing that they did not get into any Friskies, any temptation treats, or any extra canned food or people food, and see the result on the ears. If the ears have really cleared up with them being on the ZD, okay, good. We know it's food allergy now. We've got a solution. Maybe we keep them on the ZD. Maybe we do a diet trial, what's called an elucidation trial, where we give them things we might think are going to make them allergic and work at it that way. But it's a lot less stressful on the cat affected with chronic ear problems to have really the underlying cause of the problem be managed. And you can manage a multi-cat household with different diets. We can tell our clients how to be creative with separating the cats for feeding, give them timed feeding, do it 2 or 3 times a day, and still keep it somewhat simple for the client. We can say, okay, just keep the bowl and the ZD in one place for this one, and you're going to keep the other 2 bowls with the Friskies for the other 2, a little 1/8-inch cup, measuring cup, 1/8 of a cup, measuring cup, for how much you're going to feed 3 times a day. That's as much dry food as the cats need. They do not need a whole bowl that they're all eating out of. Or secondly, we can set up some food puzzles to make it more fun, but we're still controlling that the food puzzle cats are in the bathroom playing around with that, separate from the ZD cat. We can still tell the client how to do that and also show them the benefit of doing this. That taking the time and the steps to do these different approaches for helping those ears to be healthy and clear is worthwhile, because that ear pain is significant. It's significant not only in the moment of, oh, my ear was touched. It is a leading reason why, where does everybody like to pet their cat? Sure, over from the back of the neck, and we tell clients to pet them over the head. So if there's irritation and inflammation around the head and they pet the head, the cat will avoid, or the cat's going to hiss and flip to bite. We're going to have owner-directed aggression problems. So thank you very much. Think of the Selmectin for ear mites. I frankly hope that everyone is using this for ear mites. If your client says, well, I've been grabbing and using the ear mite treatment over the counter, say, get your cat in here. We need to do a checkup, and then I can prescribe this medication, which is going to take care of the ear mites. And then we have some other medication if there's a secondary ear infection where you don't have to put the drops in the ears, and it's going to make it a lot better for your kitty and a lot better for yourself. Thank you very much. Make sure you may put any comments in the bottom, like my videos. I will be sharing this up on my YouTube channel. I have a YouTube channel with many videos showing less stressful handling, as well as behavior solutions for staff as well as for clients. And have a great week. Bye-bye.